My paper today will be about external cervical resorption, relationships between classification, treatment, and one-year outcome with evaluation of the Heathersay and Patel classification systems. This is a study done by DeLuca and his group from Tufts University. The objective of this study was to evaluate the relationships between classification status, treatment modality, and one-year outcome of external cervical resorption lesions. A secondary objective was to evaluate the usefulness of the Patel 3D classification system for external cervical resorption and to compare it to the established Heathersay classification system. A descriptive analysis of external cervical resorption teeth regarding demographic, tooth type, and the predisposing factors was also presented. For materials and method, the chart review preliminary research was done of patients who had been seen in academic institution postgraduate endodontic clinic from 1st of January 2010 until the 1st of May 2022. The charts were examined by two postgraduate endodontic residents for the diagnosis of at least one tooth with external cervical resorption based on the clinical notes, periapical radiographs, and the CBCT imaging. For the outcome assessment, outcomes were classified as survival, failure, or unknown. Survival indicates teeth that were present in the mouth, functional and asymptomatic. Failure were teeth that had been extracted, became symptomatic, or presented with recurrent resorption prior to 1 year after treatment. Unknown teeth were those lost to follow-up. For the results, in total of 142 teeth with external cervical resorption lesions were identified in 118 individuals with the age range between 15 to 87. 8 potential predisposing factors were encountered in the clinical notes. Positive exposure history was reported in 36% for orthodontic treatment. 33 had a history of a prolonged exposure to cats. 32% had a history of a trauma. 12.7 had a history of extraction of the adjacent tooth. 11% has a history of a wind instrument use. 2.5% had a history of internal bleaching. 2.5% had a history of diabetes. 1.7 had a history of anti-resorptive use. There were 72 cases, which is 50%, whose outcome were known after 1 year. 50 of these, which is 69%, survived, and 30% were failed. For teeth that survived was an average follow-up time 3.4 years or 46 months. 2 cases survived for 10 years, 10 cases survived for 6 to 9 years, 13 cases for 3 to 5 years, 9 cases for 2 years, and 16 cases for 1 year. For classification of lesions, the most frequently occurring Heathersay lesion were class 4, and the least frequently occurring were class 1. The most frequently occurring Patel classification were 3DP and 3BP, and the least frequently occurring were 2CD, 2CP, and 3BD. For the relationship between classification, treatment, and outcome, there was statistically significant association between treatment recommended and Heathersay classification. There was statistically significant association between the treatment recommended and Patel classification. There was not a statistically significant association between either Heathersay or Patel classification and the outcome at 1 year. And they concluded at the end that both Hersey and Patel classification systems for external cervical resorption are effective methods for describing the external cervical resorption lesions. The Patel system, being based on CBCT imaging, provides a more accurate and detailed description regarding the size and extent of the lesion. Thank you so much for listening.